Okay, let us debunk this. I believe you who's staring at me has been diagnosed with typhoid at some point in your life. So let us agree. Do we all have typhoid or we don't? Let's clarify this once and for all. Now, from an insider perspective, I want to raise an important question for my colleagues and also for the patients we see. It's respectfully done with no issue of blame. In Kenya and actually Africa, many patients with fever are commonly told they have typhoid. But this deserves clarification, not blame. It is true typhoid fever is caused by a specific bacteria called Salmonella Typhi, and this bacteria causes fever. It is part of enteric fever, including paratyphoid, and is recognized as a notifiable infectious disease under the Kenyan law and under so many health law in African nations. According to the Public Health Act in Kenya, enteric or typhoid fever must be notified to public health authorities when diagnoses are made to support surveillance and outbreak response. So here's a very simple but important question. If many patients truly have typhoid, are these cases being reported to the Ministry of Health as required? If yes, why haven't we seen a public campaign on information pertaining to this issue of typhoid as an outbreak? And if they are not being reported, then we must also ask, are these diagnoses always accurate, or are patients being labeled typhoid when they actually have something else? It is crucial to raise these concerns because typhoid is often confirmed by blood culture, which is the gold standard, but it is rarely available, especially in resource-limited settings that we have like in Africa. And studies show that true Salmonella Typhi blood culture positivity is relatively low, even in endemic areas. For example, in Nairobi, Kenya, the surveillance data said is around 2 to 3%, meaning many febrile illnesses may be misclassified as typhoid. Other infections such as malaria, dengue fever, bacterial infection, viral infection, etc. These illnesses can present with similar symptoms, but are different illness, and the management are also different, entirely different. So tools like WIDO test, which is majorly used, and also rapid tests have limitation in accuracy and can lead to over-reporting and wrong diagnoses. So when every fever gets labeled as typhoid, what happens? Many patients receive unnecessary antibiotics. The real cause of illness is missed. That's why most of us keep on saying we have typhoid, we have typhoid, we have typhoid. And then antibiotic resistance also increases. And public health data becomes unreliable, and this weakening of surveillance. This is not an attack on clinicians or health workers. These guys are doing a remarkable job. They're doing their best under immense pressure and with limited diagnostic resources. So we give kudos to them. But as a patient, this is your duty. As a patient, make sure you do the following. Ask how the diagnosis was made. Don't feel offended. Don't feel belittled. Ask how the diagnosis was made. Ask which tests confirmed it. And ask if other causes were considered. And then get clear explanation of how it happens. So accuracy to patients and reporting to the community is very important in bringing holistic care and in bringing proper diagnostic and also bringing reliable healthcare system. So if you believe this information is important to you, or if you believe you've ever been diagnosed with typhoid, please comment down here. Patient first. Okay, this is for doctors and clinicians. If you find yourself in this situation and you've not diagnostically come up with the diagnosis of typhoid, please just say enteric fever. It covers everything. It's a blanket, and you can work under it to treat whatever, the same treatment you would have given in typhoid case, but then these are much more clear diagnoses than just say typhoid, which you know is controversial. Enteric fever works, okay?